So Mike, I was wondering if you would be willing to talk about some of your medical conditions and if any of those led you into this area.
Oh, okay. Well, yeah. I don't mind sharing with you. I hope it doesn't scare away any potential clients, but the reality is that when I was an attorney, I'd been with the state attorney's office, and then I went to a private firm for a while, and then I went off on my own and still became a sole practitioner. And virtually at the same time, I ended up going through a divorce and having custody, the entire custody of my 2 young children. And during this time, like many men, I just didn't take care of my health. And I had let a bacterial infection spread from my sinuses into my ear, into my inner ear, and it created a condition known as Meniere's disease. And then I began to suffer severely from having it.
What did it do?
Well, it involves uncontrolled vertigo, so there would be 2 or 3 days at a time that I couldn't get out of bed because the room was spinning so badly. And it involved projectile vomiting. I couldn't eat. I couldn't keep food down. And this would happen at least once or twice a month for 2 or 3 days. And at that point in time, I realized that I may have to file for Social Security disability. I picked up the paperwork. I had it filled out. And all during this time, I continued to practice law. And then slowly but surely, the stressors started leaving, and the symptomatology started to abate. I've been left with some. It's weather dependent. It's not severe. Every now and then it'll catch me, but I am left with some residual deafness in my right ear and tinnitus. But stress is a real killer, and everybody who's filing for Social Security disability is under some kind of a stress.
But I want to get back to you. Have you ever had any bouts with cancer?
Yes, hard to believe, but I've had my right eye out twice. I had a retinal blastoma that I thank Dr. Pete Babin for curing. Well, just cure as best they can. It involves taking the eyeball out and suturing radioactive flak to the lesion and hoping that it kills the lesion.
What was that? What kind of cancer was that?
Well, it was a blastoma. It was an aggressive, severely aggressive cancer on the back of the retina that, if not caught early enough, migrates into the brain and then kills its host within a matter of weeks. So I managed to, because of early detection, and it was just kind of a fluke that they picked it up. But then I battled that cancer, and I still go back 6 or 7 years ago now. But I battled that, and I was kind of looking at death in the eye then too.
And your treatment for that, did that involve afterwards getting shots to your eyes and losing vision of your eyes?
Yes, I've lost about half the vision of my right eye, and there's...
You keep smiling when you're talking about this. You're the only person I know.
Well, let's face it, it's, I'm so glad that I don't have to see those needles coming out again.
Yeah.
I mean, there's a lot of pain that goes with those treatments, and I managed to survive it and do what I do today. Matter of fact, I've also been an insulin-dependent diabetic for 12 years, and since going on the show The Biggest Loser, I ended up losing 160 pounds. And I've gotten rid of my insulin-dependent diabetes. My blood sugars are 85. My heart is back in good shape, and I'm healthy once again. So, that's kind of the direction I'm going in. I wanted to stay healthy so I can continue to do this. I want to, this is my calling in life, and I believe it's yours as well. I want to continue doing this for as long as the good Lord will let me.
Well, thank you for sharing that.
Well,